Hi, I'm Dr. Sue Mandell. I'm a radiation oncologist here at the Cadlick Tri-Cities Cancer Center. Well, originally I was always interested in med school in doing oncology, just taking care of cancer patients. And when I was an intern in the Navy down in Portsmouth, Virginia, my mother was diagnosed with breast cancer. And in those days, most women had mastectomies. Massachusetts had done a law that allowed women to meet with a radiation oncologist so they could hear about conservative management. So there was another opportunity if you wanted to save your breast. And I went with my mom to that consultation and I thought, aha, this sounds very interesting. And I just did a little bit more research and decided that's the type of cancer medicine I wanted to do. I just love taking care of people. I love talking to them, giving them information about their diagnosis. I see mostly breast cancer patients here, and I just love taking care of my ladies. I hope that I give them a lot of information and that when they leave, they feel a lot more comfortable about the diagnosis and how to deal with it moving forward. I do almost everything you can do in radiation therapy. I use stereotactic radiation, standard intensity modulated radiation therapy, and also plain old palliative care using external beam radiation treatments. Well, I'm incredibly informative, so I like to give people all the information about their diagnosis and all of their treatment options. And especially with the breast cancer patients, I feel that they should know that conservative management exists and that they don't necessarily have to take off the breast. I don't know if it's know about me, but I'm married to a gentleman who has, I think, the best job in the world. One, he raised both our two sons, but more importantly, when we were in Maine, he is a Reformed Jewish educator by training, but he ended up doing book reviews for the Maine Portland Herald, which was a local paper in Portland, Maine, and that parlayed into a career for book reviews. He does mysteries and thrillers and suspense novels, and it is so much fun going to his conventions. Those people know how to party. Well, I have to give all of that credit to my dad. I always wanted to do healthcare, so be somehow involved in healthcare. And when I was in high school, I went to the local hospital, Newton Wellesley Hospital in Wellesley, Massachusetts, and there were physicians there who were taking high school students around just to give them information and to see what they did. And my mother wanted me to be a nurse because she thought that would be an easier lifestyle for me. My father, however, said, you really want to be a physician because a woman in a health career needs to somehow be her own boss. You don't ever want to take orders or direction from other people. You want to be in charge of your own life. So that was excellent, excellent advice.